All right, everyone, and we are live. Nice. I'm still adjusting to that. You know, that intro, the countdown intro goes smoothly. Very nice. Very nice.
Yes, yes.
Hi,
Give some
everyone.
people time to log on and kind of wait for us and that sort of thing. So it's kind of
Oh yeah,
nice.
absolutely. Hi everyone, anyone who's watching right now, welcome to Casey Reacts. This is episode 23. Especially thank you to those who have been there all along. You know, we're growing, we're changing. We hope that you like what's happening here. Chris has been amazing with his tech skills. I'm about 2 steps above the Amish, so I'll get there eventually. Uh, Tonight, though, we do have a very good stream for you. You know, it's obviously been major controversy lately, and of course, as we all know, that is the case that just went before the Supreme Court, huh, Chris?
Right. Yeah.
Yeah.
It's kind of interesting. I think that, not to give away too much about what we're going to be talking about in this stream, but the thing is we've got essentially the fruits of the gay community being paired with the trans community. And this has all
Hmm.
been done, interestingly, by the left. So we're starting to see what has come of that. And I am kind of curious if some gay people, and we'll discuss that as we go on, but I am kind of curious if some gay people, more than people like us, will start realizing that it might be time to detach ourselves from from the trans community.
Oh, I think so many are on their way and they're already there. But without any further delay, though, let's jump into it. Let's get to that first image there, because you know we're gonna be discussing, of course, conversion therapy. Is it free speech? What exactly is it? You know, we had the Supreme Court just hear the case, Chiles v. Salazar, which is a case out of Colorado regarding conversion therapy. We have a special guest with us this evening, and we're excited to have him on. I'd say let's bring him on.
All right.
Hey,
All
how's it
So,
right.
going?
Welcome, Dre. Why don't you introduce yourself a little bit and let people know who you are and what you do?
Yeah, my name is Dre. I'm actually a therapist, which is a perfect segue into the conversation that we're going to have today on this court case. The things that are going on with conversion therapy and everything, and freedom of speech, just as a practitioner. And I guess you'll be getting a little bit of my feedback as a practicing therapist, a mental health counselor.
Yeah, and we're excited for that. So we're also going to get Dre's feedback on 3 brief clips that actually involve parents discussing how their children are trans and how they can be allies. So I'm excited to have Dre respond to those because I'm going to be asking Dre to actually analyze the parents a little bit, psychoanalyze the parents, not so much the
And just
children.
so everybody knows, I have not seen these clips before, so this is going to be. I have not seen the clips, so let's
I
get
know.
it rolling.
I know 2 of them actually have gone around, but before we get to that, we are going to first discuss a little bit, and we're going to go over the Supreme Court case. We're not going to focus so much on the case a long time, just a little bit. I want to cover it because it's relevant to the larger conversation about conversion therapy, and that's really where we're going to get into the meat of the issue. But before we do that, let's get started when it comes to the Supreme Court case that we're focused on, America. All right, I'm going to read a little bit of the description. We're going to go from screen to screen, then we're going to have a discussion about the case. All right, so Chiles v. Salazar is a Supreme Court case challenging Colorado's law that bans licensed mental health professionals from practicing conversion therapy on minors. Licensed counselor Kaylee Chiles argues the law infringes to free speech by restricting the counseling she can provide based on her religious beliefs. Colorado maintains the law is a necessary regulation of professional conduct to protect youth from harmful practices. All right, and with that, we're going to go into a little bit more about it in the next slide. What the case is about. The law, Colorado's Minor Conversion Therapy Law, MCTL, passed in 2019, prohibits licensed mental health professionals from trying to change a minor's sexual orientation or gender identity. The plaintiff, Kaylee Chiles, a licensed counselor, sued Colorado, claiming the law violates her First Amendment right to free speech and the free exercise of her religion. Now, that's an important point because it's not just free speech, it's exercise of religion as well. She wants to help clients reduce unwanted sexual attractions or align their lives with her Christian beliefs. The state's argument the state argues the law is a legitimate regulation of a harmful and ineffective healthcare practice, not a restriction on speech itself. The state cites evidence that conversion therapy can lead to increased depression, anxiety, and suicide risk in minors. All right, and then finally, what's at stake?
Oh, sorry.
We're still getting it, folks. Oh, by the way, folks, feel free to comment. We love your input, so remember that. All right, the legal history. Lower courts, a U.S. District Court and the 10th Circuit Court of Appeals, both sided with the state. The 10th Circuit ruled the law regulates professional conduct, the therapeutic practice that incidentally involves speech, and therefore it does not violate the First Amendment. Supreme Court. The case reached the Supreme Court after the 10th Circuit's decision. Oral arguments were heard in October 2025, and the decision is expected in 2026. All right, so with that, we're going to have a little bit of a conversation about this case. Dre, since you're the guest, we're going to throw it to you first. I mean, first of all, start with the elements of the case, which you do know, how you feel about it, and how you think it might end up unfolding.
Well, I guess the whole thing is basically like Chiles versus Salazar is basically about free speech and practicing it as a professional, and versus like the conversion therapy, right? Now, my thing is that conversion therapy, there's something else called gender affirming care, right? So my thing is that I guess if they are going to argue that this is like a professional conduct thing, where's the gender affirming care here? Because I do feel like gender affirming care, even though it's like it has like more of like this positive connotation to it, it's still kind of like a form of conversion therapy. And I just feel like as therapists, we shouldn't be affirming people's identities and even I think their sexual orientations. Like, who am I? I'm not like a truth sayer and things. I don't know like what to tell people what to do as a therapist. I just however, I think the free speech and the religious thing is very crucial as well. So this is a very interesting case. It's basically the balance between free speech and conversion therapy and professional conduct. Now, my thing is that how are they going to define professional conduct and what makes it right or wrong against the avenue of free speech? So like, I guess that's my understanding of it.
Chris, what's been your take so far?
Well, it's kind of interesting sort of thing. I think that one thing, and I'm sure that we'll get into this more, one thing that needs to be discussed for sure is the fact that I think that two different issues have been confused with each other, which is how to treat someone with gender dysphoria versus how to approach someone, because I'm intentionally not saying the word treat. How to approach someone with a homosexual orientation, bisexual orientation, or whatever the case may be. And Dre actually brought up something that I think that is kind of interesting in the sense that, we don't necessarily want someone like a therapist or something like that affirming necessarily a sexual orientation or anything like that, because that's ultimately up for the person to figure out for themselves. And but at the same time, I don't think that you can talk somebody into it when it comes to that. But we need to be careful in that. I guess my main thing is, let me back up a second. We don't affirm heterosexual relationships or any, well, we do to a certain degree, but we don't like say, oh, well, you like a girl, let's explore your sexual orientation, and it's I guess that's where I'm going with it. I took a long way to get there.
Yeah,
But it's kind of the same thing. It's like, if a kid, and I am talking about the homosexual issue right now, I'm not talking about the gender affirming care. But, if we have a kid that comes in and it's like, oh, and it's a boy, and he's like, yeah, I really find this other boy attractive or something like that. It's kind of the same thing. It's like, I would just expect a therapist or something to be like, oh, okay, that's cool. That's what you feel. And let me know about that. But you don't push them one way or another. You know what I mean?
so,
Never.
so I want to ask both of you quick though, because a lot of people who listen to the trial, and I've read a little bit here and there. I haven't had a chance to really listen to a lot of the audio with this one, unfortunately. But what I've heard, pretty much all around, is that they do believe that this is going to go in the direction of the therapist, a possible ruling what we're looking at. Now, with that in mind, I do want to ask. First, I want to start with you, Dre, on this because I really would love to get your input because you kind of touched on it a little bit. Chris did a little bit. I'm going to directly dive into it, and then we're going to get to a larger conversation on conversion therapy itself. But right now, right? The irony is, as you said earlier, right? The left, when they're transitioning a child, right? When they're a little boy who has not even, they necessarily don't even have gender dysphoria. They're just confused, maybe has feminine aspects, stuff like, interest, stuff like that. When they get that little boy to encourage him to act like a girl and eventually puberty block and stuff, that is conversion, right? That is a conversion, most assuredly. So now, if this court case comes down, right, on the side of conversion therapy covered by freedom of speech and also religious freedom, is there this risk now that the left, those who push the trans ideology, they're going to be honest and say, well, this is conversion therapy, and it's our freedom of speech and even our freedom of religion. So I know a lot of people on the right, especially, are really cheering for this to go down on the side of the therapist, right? Religious freedom, freedom of speech. But are enough of them considering what that fallout could be if the left's like, okay, well, it is conversion therapy that we're pushing, and it's our freedom of speech and it's our freedom of religion.
And that's pretty scary. That's the confusing part about all this, right? I think it's like,
Yeah.
Is it the freedom of speech, or is it that we, just allow practitioners to practice whatever they want to do based on their own values and their freedom of expressions and things like that? But like I said, I think in professionalism and as a therapist, we're not really here to basically tell someone what to do. If someone's coming in with those goals and I am trained in that field, I can help you on that. However, I'm not trained in gender affirming care, and I would not even want to train in that. And I personally wouldn't want to train in conversion therapy either, just because I think it's a little, I think the practices might be a little off in my opinion. But if somebody comes in and they want to work on that, I probably have to just refer them out to somebody who specializes in that. And even with the kids that want to be affirmed in their gender and whatever the case is, I would always talk to the parents first anyway. I involve parents heavily in the whole therapeutic process when it comes to working with kids. I think that's very crucial in therapeutic work.
Absolutely. Chris, what's your take in regards to the possibility of abuse from both sides, actually, from the left and the right?
Yeah, Dre hit on something that I think is interesting. And I'd be kind of curious, Dre, if you could maybe refine it a little bit. You did the answer a little bit, which is you said something about the practitioner engaging in things that align with their values and that type of stuff. And I think that there is, and maybe I'm wrong, so correct me how I'm wrong, Dre, for sure. But I think that my knee-jerk reaction to that is that a therapist should not necessarily. I mean, obviously, we're all human. We're going to put our you know personal spin on things. But generally speaking, I don't want to see a therapist interjecting their personal opinions into things. I would rather see like concrete examples of proven research being used in those situations, and not so much a gut instinct or personal opinion or something like that. I just think that that's safer, especially when we're talking about kids,
Yeah.
because they are so easily influenced, especially by adults.
Mhm.
So, what do you think about that, Dre?
Yeah,
I mean,
I
yeah,
think on the idea of like personal values and stuff like that, like on my personal values, I don't agree with gender affirming care. So I'm not
sure,
gonna practice that. You know what I mean? Like I'm not gonna that's my personal take on it. I don't trust it. I even if you look at the research, it's pretty
right,
flawed in its practice and stuff. Like you know, we could go into that as well, but going to your question, it's just like, you know, obviously every therapist does have their values and they do take certain interventions that they feel comfortable using based on what they believe to be legit and valuable, right? And I think that's the whole idea of the freedom of expression, freedom of speech. Like there are Christian counselors, right? I mean, there are
sure,
counselors that are part of like a church and they provide counseling to those individuals, and some of them are trained mental health counselors as well that kind of infuse the two together. Like if I wanted to, I could become a Christian counselor and I'll be spreading my own values into my counseling orientation. But the thing is, people will know that they're coming to me because I'll market myself that way, right? So it's about allowing people to know like who you are as an individual, as a counselor, what your beliefs are, and kind of practicing in that direction. Like I tell clients all the time that come in, like I have trans clients and I tell them, look, I'm not a gender affirming therapist. Like I'm just telling you from the beginning, from the get, so we get that straight up clear. I'm going to respect you for who you want to be and who you are, but I'm not going to affirm that because I just don't believe in affirmation as a therapist. So that's my role as a therapist. I think that can be in line with the value, I guess, in some way. Like I just don't feel that that is like my place to affirm stuff in people.
and you know what, Dre? I mean, actually, and Kevin knows this about me. I like to play devil's advocate for a little bit,
Yeah, I
and
like that too. Keep it coming and making
I
the
know,
conversation more interesting.
right? And I
We'll
just
get
did
there
that.
more. Don't worry.
I'll just let you know. I just did that with you.
Yeah.
My more just personally about me. I mean, I think that more what I'm talking about, if I'm going to talk about my actual personal instincts,
Mhm.
is that I think that not gender affirming care, I'm sorry, but conversion therapy is, and I don't want to put the cart before the horse here. So if I'm getting too ahead, I'll slow down. But I don't want to see uh, therapists engaging in conversion therapy when it comes, or even talk therapy for that matter, when it comes to younger homosexuals. And the reason I say that is because that is putting a personal spin on it. And interestingly enough, it doesn't even go along with research or anything like that. And so, or at least the small amount of research that we have on it, I guess I should say that. So you know, there, I don't know, it's kind of interesting. It's like there's times where it seems appropriate to put a personal spin on it, and sometimes where it's not appropriate to put a personal spin on it. And, you know, I mean, I guess that's what I'm saying. Is I think this goes back to exactly what I was saying before, Kevin, Dre,
Mhm.
is that we've confused two different things together. We were talking about conversion therapy,
Mhm.
and the thing is Dre's really talking about conversion, so-called conversion therapy with you know, the so-called transgender kids. I'm really, see, the thing is, I'll be the first to admit,
Mhm.
I don't want to see any kid trans, period, whatsoever. I think it's absolute, excuse my language here, kids, bullshit. And you know, but at the same time, I also don't want to see younger gay people have to go through that sort of thing.
Mhm.
So we have set ourselves up for this weird situation where we're talking about conversion therapy, but we're not really talking about the same thing. We're talking about something that is like an absolute confusion about what your sex is
Mhm.
versus I just like this over that.
You know, Chris, I think you're going into a good conversation on distinction. But before we jump in there, I actually want to move on to the next slide because I think you just gave us a great segue for that. You mentioned research, Chris, because oh, sorry, it's the 6.
Oh, I'm sorry.
Yeah, no, that's
Uh,
fine. All right,
that one?
so
There we go.
Dre, I'm going to read these off because I want to have a discussion because obviously one of the main arguments everyone talks about research, right? Now the research to date has shown a negative consequence when it comes to conversion therapy. Now to clarify, I'm sure many of you already are aware of this. When we're talking about conversion therapy this evening, we're talking specifically, obviously, sexual orientation and gender identity. So I'm going to read off these psychological and emotional dangers that apparently research has shown. All right, so increased suicide risk. Research shows that LGBTQ plus youth who have undergone conversion therapy are significantly more likely to attempt suicide. Family rejection, which is often a component of conversion practices, is also strongly linked to higher suicide rates. Mental health decline. The practice can cause or worsen serious mental health conditions, including depression, anxiety, and post traumatic stress disorder, PTSD. Reinforce self hatred. By aligning with societal prejudices, conversion therapy can reinforce any existing self hatred felt by the individual, leading to feelings of guilt and shame. Loss of self esteem and identity. Conversion therapy can diminish an individual's sense of self worth and undermine their core identity. Substance misuse. Exposure to conversion therapy is associated with higher rates of substance abuse. Now, Dre, before you go into that, because I'm going to throw it to you first, because I really want to get your opinion on that. I do want to say this. When I was reading this, when I found this a general description, right, and I was reading these dangers of conversion therapy, every single one of these that I read pretty much applied also to what we've seen the results of transitioning minors,
Mhm.
right? Of all of these damaging consequences we've seen from personal testimony of individuals who were transitioned when they were very young and they experienced all of this as well. Because so first, actually, let's start there because Dre, here's the thing. I like to say research suggests, not research proves,
Yeah,
because every study, in my opinion, you could find a flaw in it if you really go at it,
of
right?
course.
Whether it be sample size, was it a double-blind study, was it self-reporting? What was this study? So research suggests is what I try to say as often as I can. Um, so Dre, actually, yeah, let me just throw that to you. What's your take on these dangers right here and the research involved?
Well, I just want to say, first of all, every time it comes to research, I know in science, especially psychological research, nothing's ever 100%. Just going on what you said before is like, the research doesn't show a cause that this causes those things, right? In research and psychology, there are plenty of confounding variables that you have to consider within research. So I wonder what the percentage are in the increased risk. Like, what is what percentage of increase of suicide are we talking about here? What's the demographic that we're talking about here? These are the things when it comes to research, I just like to critically think about it. And I like to question a lot of what I'm reading. So basically, I wonder if that all of this stuff is true, because I'm pretty sure, out of like the 8 billion people that are out there, I'm pretty sure there's one person who would want to do conversion therapy for whatever reason. I don't know why, but it's something that some people really want to go towards and do. And I think that that's the point. I think people should have the freedom to choose a certain therapeutic intervention that they want to use, even though if it sounds like it's a little like, I guess, like dangerous. And I'm talking more on the basis of adults, right? Like, not for kids, obviously leave the kids out of this, but when it comes to like an adult wanting to really try to shift their sexual orientation, I'm not going to practice this. Like, to be honest with you, I'm just going to tell you straight up, I don't agree with conversion therapy as a therapist. That's just my personal take on it. I don't think it's a healthy thing based on this research and other research as well. But I'm pretty sure there's somebody out there that would want to use that. And I just feel like to take that away from that person could be more detrimental as well. They could probably be suffering with whatever they're going through in their mind as well. We don't know, you know, so you can't really go based off of all this research, because there's people out there that might see it completely different and really want that help in that regard. It's not like 100%, but I'm pretty sure there's people out there that might need it. And I'm pretty sure there's been cases where it's actually probably even helped people become less suicidal, have mental health decline. I mean, that's why I'm trying to question, what is the demographic here? And I think that that's something that it shouldn't be like completely banned. It should be something that could be used if somebody wants to use it. You know what I mean?
Yeah, Dre, it sounds like you're saying let the patient guide what's going to happen in the therapy, not the therapist
All the
lead,
time,
right?
all the
So yeah,
That's how it should be. That's
I-
that's what it is. I don't come here and meet a client and say, these are your goals. No, what are your goals? Why are you here? What is the
so it's not
distress?
boot camp.
Yeah,
It's
it's not
not
a boot
okay.
camp.
Here's what you got to do.
Hey, unless somebody's goal is I need to hold myself more accountable for things, all right, I'll help you with that, you know, but this is the treatment plan and these are the goals
Yeah.
and we're going to do that. But yeah, I think that you know, that's my take on it. Personally, I won't practice this stuff, but if there's somebody that does and somebody wants to try it out, like let them go, as long as they sign the consent forms, as long as they know, hey, look, these are the risks right here that are written in this you know, stuff. This is what you're looking at. Hey, same thing for people who want to transition. I mean, once they go into hormone therapy, there's worse risks than what you have listed here. There's heart problems, bone problems, brain problems, hypothalamus problems. You know, you're messing with someone's hormonal system. But if somebody says, you know what, I think that the benefits outweigh the risks, sign off. That's it. And you sign off, that is your consent. You're giving consent to the therapist to practice what they've been taught to practice.
Chris, I want to ask you, Chris, quick, because I know I said after I read those, right? I read that and thought, wow, Chris, you and I have done the same kind of work where you've done a lot more of it than me, and you did it for longer, of course, and you've been out there on the news, all that stuff. You've been in the fight for a while. When I was reading these off, and when you looked at these, was it the same as what I said, that I felt like this right here, all these dangers could apply to the idea of transitioning a child just as much as conversion therapy in the other direction?
More, more.
Yeah,
Yeah, more.
I mean, this is complicated, especially with the Supreme Court case, because, like I said, I have to keep coming back to the fact that unfortunately, two completely different things have been lumped together. I mean, really, this court case is about like, oh my God, how should we treat heart attacks versus how should we treat cancer, and let's go ahead and treat them the same. That's what this court case is about. And so that's why I think this is absolutely a stupid court case for the Supreme Court to actually bring up. Because we're dealing with two completely different things here. Now, that said, I mean, Dre brought up something that I find very interesting, because he was talking about, or you were talking about, Dre. I don't want to act like you're not here, God. Anyway, but one of the things that you brought up that I thought was interesting, because it's something that I used to also think, especially when it came to the trans stuff. It's like, okay, so you're an adult. All right, fine. You can go ahead and do your adult things. And therefore, if you feel like this is something that you absolutely must do, go right ahead and go forward with it. Okay. There is a problem with that, that I started finally discovering, while kind of like working through this in my own mind, which is that when we're talking about conversion therapy, whether it's sexual orientation, and this is maybe where they sort of do come together a little bit, conversion therapy, or the opposite of it, which is the situation with the transgender stuff. It's like, okay, I have a problem with the medical industry as professionals facilitating what I see when it comes to the transgender stuff, facilitating self mutilation, and also, taking drugs that they don't really need or something like that. And it's kind of like, oh my gosh, yeah, this person wants to explore cutting off their arm because they feel like they should have been, mutilated, that sort of thing. We're obviously not going to explore those things as well. And it's also kind of the same thing with sexual orientation. Sure, somebody might want to explore changing their sexual orientation for whatever reason, because maybe they've been made to feel bad about it or whatever the case may be. But also at the same time, I would also hope that a professional would step in and be like, maybe you shouldn't do this. Because if
Mhm.
I go to the doctor, and this is what I'm saying, Dre, if
Yeah.
I go to the doctor and I say, and they do a blood test on me and they find out that I have high cholesterol, and I'll be like, I want to explore combating high cholesterol with eating as much red meat and eggs as possible. Let's see how that works out for me you know and I think that's what I would say to challenge you a little bit, Dre. I'm
Yeah.
not a professional like you. I'm
Yeah.
just talking from the common man, sort of like common sense sort of thing. It doesn't quite make sense that the patient should be able to 100% guide the conversation.
Mhm.
It's like, to a certain degree, we're coming to professionals because we need good advice.
Yeah.
And so I don't necessarily want, the person who feels bad about being homosexual exploring that with a therapist, because it's like the therapist, in my opinion, should be saying, why are you doing this? Why do you want to change this? You know, what's going on here? And find the deeper reason behind it, because I can guarantee you it has something to do with guilt and shame and all that type of stuff. Um, the same thing with like the transgender stuff. It's like, okay, well, I think I should change my sex. Well, the therapist or the doctor or whatever should be like, why do you want to do that? So
Yeah.
I think that's where I'm coming from, and where I do, in this instance, I do see a little bit of commonality.
Yeah, no, and I completely agree with you. Like, I believe in that too. Like, personally, at my practice, what the three goals of therapy is: self empowerment, basically, what was it? Self empowerment, uh, to some degree, accountability. But the third one is to get the client to the truth as close as possible. And like
That
that's
sounds
that's
fair.
and like that's basically like the three goals in my practice that I instill in the therapist here. And I'm just like, look, these are very three important things. Are the self-empowerment is a big one, like to be self-empowered, to understand that you have the capability to change things, and then the other one, to get to the client to the truth as close as possible. That's like one of the goals as well. Like, so what you're saying kind of aligns with even my practice's goals, which is basically, yeah, be honest. Like, I don't, every time I get a trans client and I talk to them about their medication usage, I always try to like encourage them, keep talking to your doctor, follow up on your visits, like that stuff is affecting you in some way that you have to be on top of. But at the same time, I just don't have the authority to tell someone what not to do. You know what I mean? So it's like there's the freedom aspect, right? Like, I know it sounds bad, but that's where then it gets even deeper, right? Like, how far can freedom really bring us to? Freedom could be detrimental within itself to some degree. If you have constant freedom to practice certain things, yes, then you can go ahead and chop your arm off. You're free to do that, But should we as professionals hold a certain conduct of truth within our practice and tell people like, look, why would you want to do that? That would affect you in this way, and that way. And that's the truth. You know what I mean? So I think that's usually typically my approach, especially with like the sexual orientation and the conversion therapy. I'll never tell somebody, I think you should not feel that way. I think that's just how you really feel. And that's okay. Like it's whatever. It's your thoughts, it's your feelings, it's whatever you feel. I don't really try to guide anyone in any direction that they don't want to, like, that's an aversion to something. Like, I don't, I try to like just be like, all right, that's how you feel, that's fine. Like, but let's explore what your lifestyle is like. Are you taking care of yourself? Are you doing things that are important for your health and your physical health and stuff like that? So that's the type of approach I take. And like I said, like, I'm not a fan of conversion therapy. I don't really, personally, me, I just don't agree with that. I don't use it. But also, what I was saying before is that I'm thinking critically. I can't take this research for 100%. I know there's people out there that really might want to play with their sexual orientation, or and it might be from guilt or shame. But hey, if conversion therapy has a process where they explore that and they dig deep into that shame and guilt or whatever they feel, and then they go on and do like a strong assessment or something, by all means, like I think that sounds like a little reasonable, as long as it's explored. Like you shouldn't just be like, no, this is how you feel, so then you should just convert to whatever you feel. I think there's ways to go.
Your
No,
your fee-fees.
no, that was very fair, Dre. And to be quite honest, I really appreciated that. Because it's like I think that's fair, and you are talking here to somebody who I mean, I definitely lean conservative, but I have a lot of libertarianism in me. And so I do want to see people make decisions on their own that are in, that they see fit for themselves. But at the same time, I do wonder, it's like, and this Supreme Court case that we're talking about really gets down to it. It's like, to what limit does the professional have, or to what extent does the professional have an ability to interject their own opinion into something? And I think that has been kind of my concern about this woman that has filed this case, or has gone through the process and got it all the way up to Supreme Court, is that, it sounds to me like she's really wanting her religious beliefs to guide her practice. And, on the surface, again, as someone who leans a little libertarian, that sounds great. But then I can't help but realize that there is a problem there. Because yeah, sure, in this country we're all going to talk about wonderful Judeo-Christian values, and that's what we need to push. Sounds great, right? Okay, so let's talk about Sharia law and a therapist who subscribes to that. And that's the problem that I am seeing with the potential outcome of the Supreme Court decision, especially if they side with the therapist, is it's like, oh, well, it sounds like a free-for-all now. It's like, whatever your religious beliefs are, we'll let that dictate your therapy. That does not sound particularly good to me.
I think there's like a point of like, I think with things like this, you don't necessarily have to agree with these things, but I guess to some degree there could be a level of like, I guess to understand it is like a little powerful, but it's hard to understand something. And I think, a misunderstanding, like I guess, when people don't understand something, it just confuses them in many ways. But I just think, it's something that we all have the freedom to disagree with it, and I think that's perfectly okay. I think if you don't agree with it, you don't agree with it. But like I said, there's probably people out there that might actually can probably less likely, probably rarely benefit from something like this. But it's really up to the individual at the end of the day and what they want to do with themselves. So I think.
Yeah, so Chris, do you mind if I take over a little bit? I want to throw some things at Dre here because I don't
right
mean like
ahead.
aggressive.
Sorry,
Don't worry, I'm not going to go on the attack, Dre. No, I just because Dre, you and I had a brief conversation overall about this, and one of the things that I expressed is, especially when we're dealing with minors, that's where I'm all about. We definitely need to be incredibly careful. I know I'm going to reiterate a few things that were said prior, but I feel that it's worth it because some people have responded to this. Well, it's just talking. All right. Now, anyone who's ever engaged with a teenager, especially, knows that talking is never just talking. They take just about everything out of context. Things that are not insults, they take as insults. I mean, it's so that's my concern is when it comes to children in general. Rarely is talking just talking. Like, for example, one of the reasons that I actually despise that show Queer Kid stuff, right? With that nutter Lindsay, is because of how she uses language. For example, one of the ways that she describes being gay is when a boy likes or loves another boy. Now, I feel the reason that is, yes, it's words, but to a child, that's not just words, because that little boy probably has male friends that he likes and even loves. So if all he comes to understand is that being gay is when a boy likes another boy or loves another boy, then here's that wording, he's going to have a very confused understanding as to what that is, which is all the reason I don't think anyone should be having these conversations with children, especially small children. But so do you have a concern about that? Because I know adults, I know Chris touched on the fact of even for adults, that generally don't support this either. And there is definitely an argument to be made there, which I want to go on to with my next point. But before I do that, how do you feel about that? I mean, are words ever just words with minors, Dre?
Well, I think you got to take it from the perspective of like human development, and go into some theoretical ideas about how cognition develops in kids, right? Like kids are known to be very rigid in their thinking process, and they see things very like black or white. That's why a lot of kids tend to be extremely honest, because they don't really think about the consequences of telling the truth. So a lot of times you'll see kids being extremely honest. So just in psychological science and human development, we know that kids at a very young age think very black and white and very rigid. So they take things almost literally. And for that, when a lady says something like that to a child, they'll take it literally, and then it'll become part of their schema, and they'll assimilate that into their belief. And then they'll start to believe things, whatever they're being told. So yes, kids are like sponges, they take things into consideration. And I guess that's to go on that, I guess, that idea. So I think when you're talking to kids about these things, I think it's important to be mindful, right? And this is why, for many years, it's always been trying to prevent kids from viewing like sexual content and things like that. This is why they have, parental guidance controls and stuff like that, and television shows and everything like that. That's very important, because if they see things, they're going to question it, and then whoever guides that sort of questioning to the child, they'll think it rigidly, and it could, shape them in some way to some degree.
So, which actually kind of feeds into something that Chris had already touched on a bit. With adults, right? Generally, adults are going to go to a therapist to resolve an issue based on experiences they've had, right? That's generally what's going to motivate an adult. Whatever they want to fix is usually the result of an experience that they've had, and that's how they pursue it. I do want to touch on one other aspect, because for me, as I've said before with both actually Chris and Dre here, is I like to deal with the general, the macro, and get down to the micro, the specific details. So at least in my personal perspective, I actually do believe that all therapy at the end of the day is a type of conversion therapy. You are trying to convert someone from one state of mind to another. If it's someone who's an addict, for example, you're trying to get them to a state of mind to where they can control their addiction. If it's a couple that's having marital issues, you're trying to get them from a chaotic state of mind where they're not cooperating, not seeing eye to eye, to a place where they have some peace and they can have some discussions and stuff. So there's, in general, so then we get down to the details, which, as I said earlier, we're talking about sexual orientation and gender identity. But with adults, though, and it's moving a little bit away from the children with that. Well, actually, sorry, there was one more thing I wanted to ask you about that with the children, where I was going with that. So adults are coming from a place of experience, usually, right? For children, for minors, generally, I'd say that we'd be safe in arguing that a lot of when they go to a therapist, it's from pressure from an adult in their life. It's not them saying, well, I've had a tough time in life, I'm going to go to a therapist of my own free will. Generally, it's an adult pressuring them in one way or another. So I guess the concern then here is, just as from the trans ideology, there's the concern that the child isn't confused about their gender at all. It's the parent who's pushing them because, oh, I don't know, Tommy likes pink and wants to play with dolls, so that means you're really a Tammy, Tommy. And so there's that. And then on the opposite end of that, a child expresses interest in for the same sex, or, for example, well, that parent is like, no, that's disgusting, that's horrible, I'm going to push you into therapy. So I think there's a place of concern here, and something we need to focus on is not so much the motives of the child when a child is in therapy, but the motives of the individuals behind that child that is pushing them into therapy. Dre, what do you have to say about that?
Well, I have to say a lot. I mean, like, first of all, I guess this is why, a lot of times when people come into therapy with like trauma in their childhood, I always try to tell them like you shouldn't really like put so much emphasis on that, because you have no control when you're a child of things. I think generally children don't have that much free will that adults do. And for whatever happens to the child, it's not their fault. You know what I mean? I think in a lot of cases, I mean, even when I work with adults that have like sexual abuse trauma or just trauma in general from their childhood, it's kind of like understanding that helps them in some way, understanding the fact that like, well, I was a child, what else could I have done? There's nothing I didn't know what that meant. I didn't know what it was. So, I kind of talked to them about like, you can't really blame yourself for things like that. Yes, parents definitely very responsible for the kids and their outcomes in many different ways. I mean, cross-culturally, parents instill certain values cross-culturally, and you see how that kind of plays a role in their development and stuff. I mean, some cultures emphasize the most weirdest things with their kids, and their kids end up becoming that. You know what I mean? And I think when it comes to the trans stuff, yes, I think parents are the ultimate ones that actually kind of push that stuff. And I have like well, I had had friends that were like extremely on the liberal end, and would promote that stuff to their kid, like paint their nails and do all these things and stuff like that to like their 5-year-old child. And I just saw that, and I was just like, kind of like, you're you're pushing something onto the child. Like, they don't even know what painted nails even means. Like, they're not a part of that society yet, and they will be eventually. But as of now, let them enjoy their innocence. Let them enjoy the freedom to just be a kid and enjoy themselves as they are. Like, why are you gonna push that? Why are you gonna choose that? It's just like an interesting thing. But a lot of people then argue, if I'm playing devil's advocate with myself, a lot of people would argue then, parents that buy their boy toys, like cars and stuff like that, and don't let them buy dolls and things like that, could also be pushing something as well. You know what I mean? So it's like, I think just naturally, I think parents are going to be the pushers of a lot of their values and their ideologies and things like that onto their kids. And, it's interesting because personally, as a therapist, I'm very pro parent. You know what I mean? Like, I'm not going to argue with a parent what they want for their child. So yes, if the parent, and I've had this case before, is pushing transgender ideology on their kid, I'll just say to the parent, like, well, let's talk about let me psychoeducate you on the consequences of that, just so your child might most likely get bullied. They might likely they might transition, which leads them to medical interventions that they're probably gonna have to stay on for the rest of their life, etc. That's as far as I can go, is just psychoeducate them on these topics, like telling them the truth, right? Like we talked about, bringing them as close to the truth as possible. But when I do that, I'm not going to tell the parent, don't do that, but I'll psychoeducate you on the truth, right? And I think that's my approach in those particular situations, which I've had.
So before I have two more things I want to throw at Dre, but Chris, do you want to insert with anything before I toss these at Dre?
No, I mean, really, everything that he's saying is very enlightening. As far as like from a therapist standpoint on these issues, I mean, it's great that we have careful therapists out there like Dre. I'm just afraid in the situation that we're dealing with the Supreme Court that we're not dealing with a therapist who is like Dre. I mean, this is a person that ultimately, from my read on everything, is truly looking to push her religious beliefs onto her patients. And like I said, if we get to this point that is somehow codified in constitutional law because the Supreme Court said so, then I'm really kind of concerned about that. Not because, I mean, yeah, I'm kind of like concerned about the Christian therapist who wants to, or like, I shouldn't say Christian therapist, I should say maybe extremely conservative Christian therapist that wants to push their religious ideas onto a child, like, with homosexuality. And if you guys haven't figured out, for the audience there, that's what I'm really concerned about, the trans shit. I'm like, yeah, get the fuck out of here. But but that is the thing. It's the gay thing that I'm really concerned about. I don't give a shit about the other thing. But I mean, I'm just being honest here. I mean, yeah,
That's what
go
we
right
need.
ahead and talk conversion therapy to someone who thinks their kid is trans. I don't give a shit, because, I mean, you're harming your child. My God.
So, actually, Chris, you led me to another point that I want to talk about. And it connects to research. And Dre, this is where I'd really like some input from you, and that is results. Because I know, Dre, part of our conversation was when you and I spoke, as we've been speaking here, is obviously the data sometimes is skewed, sample sizes, all that stuff. So the idea is results when it comes to conversion therapy. We know that the conversion therapy from the left, such as transitioning minors and stuff like that, we've seen the even deadly consequences, right? There's time of euphoria after initial transition, especially with adults, right? Where they do feel good, and then at about 7-year mark, they take a dip. We've seen that. We've seen many cases, increasing cases, and where obviously children who were transitioned as adults, they come to the realization this is wrong, right? As we saw with John Money and his incredibly sadistic and evil research, child abuse. Let's just be honest. So here's the thing that I have, though, is when it comes to quote unquote results, right? From that perspective where Chris was just talking, let's focus on sexual orientation. I remember over like the past decade or so, even a lot of those who took part, especially religious organizations that took part in conversion therapy, they never really claimed to remove the attraction, only help suppress it. And my issue, and going back to it, when it comes to this specific focus of results, is that mainly you're dealing with self-reported, right? Anyone can say, "Oh no, I feel completely cured of something." We saw actually several cases in the ex-gay movements that have taken place, for example, where the leaders were, "I'm completely cured of my homosexuality." Oh my goodness, they're suddenly found at a gay bar or hooking up with a guy and eventually come back out. So, I mean, to be honest, and I'm going to say this in the most respectful way possible and the most not crude way I can, is really the only way to test these results in any kind of confirming sense would be to use certain devices that gauge arousal when an individual sees something specific, right? So that personally, at the end of the day, when I think of results from this, that is what I think. I when it comes to the conversion therapy, self-reporting, I have such a big question mark when it comes to it, because anyone who really feels that they've conquered something or wants to believe they've conquered something, of course they're going to say, "Woo, I'm completely cured of it," whether it's their sexuality or addiction to alcohol or whatever it may be. They're going to be like, "Oh, I'm completely cured," right? And that's their self-reporting. I don't want to ramble too much, so Dre, I want to throw that at you. The results. What's your take on the so-called results?
Well, I mean, the results, I guess, like for self-reporting, I mean, it's very subjective. Like you said, it could be anything could be self-reported. It could be a lie. It could be the truth. You don't really know. But then it's interesting because a lot of these other interventions are based on self-reports as well that we pretty much use that have great results, supposedly. Like cognitive behavioral therapy has research based on self-reports. And we're okay with using those, right? I mean, yes, they do instrumental measures of like depression scales and things like that have good validity and reliability. But even those are kind of self-reports, right? I mean, anyone could kind of like feel like, "Oh, today I feel good," actually, and the question is like, "How do you feel today?" It's like, "I feel good, I feel great." So it's there's a lot of subjectivity. This is what I'm trying to say. Like with the science, it's never really 100%. It's just you have to be mindful. There's a lot of subjectivity within psychological science, and that's just the truth, you know. And I'm not gonna like, yeah, that's my take on it. And also, like, just going on the gender affirming care stuff, just real quick. I know it's a little different than conversion therapy, but that stuff, when you look at the research in that, like, there's one study that the results are based on a therapist's notes, session notes, that, you know, so then you question, like, the therapist, like, what type of therapist was this? And the only key words that they looked for in that study were words like regret or denial and stuff like that. Well, what about the words like depression, suicide, anxiety, increase, decrease, neutrality, stable, etc.? What were those words in this study? So a lot of those studies that show that gender affirming care is actually like a positive thing, or there's good results, you got to look into like what the methodology is. And a lot of that research is really flawed in the methodology, if you were to ask me, which I don't even know why the hell that stuff is even like published. Like, for someone who critically thinks will question it and say, like, why aren't we looking for these type of words? Why are they just searching regret?
Yeah. So I have two more things, and then we're going to move on to the video clips. Chris, I'm going to, of course, I apologize for any manipulation on my part. It's just, I love having this opportunity with Dre here. He had me under the microscope once. No. Dre, I guess, okay, next thing I want to move on, though, to is the harm, right? Because a lot of people say, especially with adults, right? Adults can choose it, right? Because it's their bodies, all that stuff. And we try to, I think we've come to assume that in the therapy, when it comes to the mental health industry, the field, that it's correct. Let me know if I'm correct, that it's similar to that oath of do no harm, right? And so you could say then that where you draw that line in therapy is when it causes harm. Now, the reason I'm concerned about even that is because that is a moving goalpost, in my opinion. And we see that in the West. Where do we see it? We are seeing some Western countries where therapists actually are encouraging people to unalive themselves if they are severely depressed. We know that we're seeing this. This is continuing. So in these countries, we've seen a shift to where encouraging someone to basically wipe themselves out of existence is healthcare, right? In mental health. So that actually concerns me, even with adults. And I think this is where I'm wrapping back around to Chris, what Chris said is, should we not only be legislating this with minors, but also with adults? Because I will admit, I look to Canada. I look to some of the Nordic countries. I look, over to, Europe. And I will admit, I'm scared. I am actually terrified as to where that's going, because that goalpost of what is doing harm keeps getting moved, Dre.
So you're talking about euthanasia?
Euthanasia, yes. I say, unalive, all that stuff. So there's actually encouragement for people, not just people, because it always starts with, well, if you're suffering from a life-threatening illness, there's no hope, right? Then you should have the right. That's usually where the argument begins, right? Then you should have the right. Now we see countries going to where if you are severely depressed and feel completely lost, then you do have the right to unalive yourself. You do have the right to choose that option. And that terrifies me, because that goalpost, like I said, of do no harm seems to be shifting in the medical field. So, I know I just threw a lot at you there, Dre. I'm going to let you.
It's just ironic to believe that as a therapist, because, like, at the end of the day, we're mandated reporters. So we're supposed to actually, like, report by law if somebody comes in and says they're suicidal or homicidal or any type of child abuse or elder abuse. We're mandated reporters. So to say to someone who's depressed, you should like try unaliving yourself, I think that just goes against the actual standard protocol in our field. So it's like a weird thing that I think therapists that I don't know. I've never seen that before. I don't know. I mean, I'm pretty sure it probably exists, but I think that's like goes against the code of ethics and mandated reporting and stuff.
Yeah.
Yep. And
yeah, for sure.
And I know that's true right now in America. That's why I was referencing other Western countries, because that tends to seep itself into America as well. Because I actually know people who support, right, assisted suicide, for example. right?
Look, I wouldn't be
And
surprised if it comes here. I mean, is that going to be the next progressive movement that we're going to have to fight against? I mean, it probably is, but I'm probably not going to, partake in that. And I think
yeah,
that's actually pretty
so
ironic.
yeah, so that's why I just want to touch on what Chris talked about earlier a little bit, moving on from just conversion therapy when it comes to minors, or therapy even when it comes to minors, but also limitations when it comes to what adults can request out of therapy, what therapists can even say to adults. Because, like I said, if you look it up, and I've actually read so many articles on this, there is a shift in the Western world towards unaliving yourself. You have absolutely, and therapists can encourage it if you truly feel that there's no hope. So that I just wanted to get your take on that.
I guess like if you're gonna want to do euthanasia, do you have to get like a psychological evaluation for that? I guess is a question.
They do require psychological evaluation, but to be honest though, it concerns me that any therapist would do any kind of psychological evaluation and think, yep,
Yeah.
let me check right off on they can unalive themselves, they can
That's
off
weird.
themselves. That terrifies me
That's
that a
weird.
therapist can even do such an evaluation to
Yeah,
permit someone.
I see where you're coming from, Kevin. For a second there, I wasn't. It's like when you brought this up, I was like, "Wait, why is he bringing this up?"
Yeah,
But it actually makes a little bit of sense now. I get it, because what we're talking about is essentially what I was talking about earlier, which is the patient comes in saying, "I want to do this,"
mhm.
you know. Um,
Mm-hmm.
yeah, I mean, this is a very complicated situation because it's like, on one hand, I've been saying, no, we probably shouldn't be listening to everything the patient says because God knows people come up with some crazy stuff,
Oh yeah.
you know. But on the other hand, you don't want the therapist to necessarily interject too much of their personal opinion, especially when we're coming to religious stuff. Because, I mean, let's face it, guys, I mean, I'm a very faithful person to God. But at the same time, I'm also aware that there's lots of other people that call themselves faithful that I would consider batshit crazy, and I wouldn't want them to touch me or anybody else with a 10-foot freaking pole, you know?
Mm,
So, I mean, it's like, we are dealing with a very complicated situation here.
Mm-hmm.
But as far as this Supreme Court case is concerned, it's like the thing that I keep coming back to, guys. What complicates this even more is we're mixing two different things that don't have anything to do with each other. And unfortunately, and I will say this, there are a lot of people out there that do think that they have something to do with each other. And I will say that this is definitely prevalent among the more conservative religious types, um, because they think that homosexuality can be cured.
Mm-hmm.
And they think that transgenderism can be cured. Well, I don't know about cure as the answer to transgenderism
Mm-hmm.
because I'm not a professional. I'm not going to sit here and pretend that I am.
Mm-hmm.
So I don't know that cure is the right word, but I do think that you can help somebody through that so that they don't have to go into a lifelong situation of medicalization.
mm,
Mm-hmm.
You know, um but when it comes to sexual orientation, I mean, that's kind of where, you know, it's like these people do think that that's something that can be cured.
mm.
So, yeah, it's very interesting. And, as Kevin knows, and Dre, I'll just go ahead and fill you in. I mean, as someone who's running for a statewide office in Missouri, I've had some really interesting approaches about me being an open homosexual and that sort of thing. And I've gotten these interesting comments about the fact that, I need to stop being a homosexual because I'm spreading AIDS. That is something that I actually heard, even though I'm married and with one man. Um, it's like, so this whole situation is kind of funny to me because on one hand, the left got us into this situation where homosexuality and transgenderism have been combined, but then the right now is taking that and going, yeah, they are the same. We're going to agree with the left here. We're totally going to agree with the left. And yeah, they both can be cured. And, as a guy who is running for office, I'm just kind of like, damn, what do I do with this absolute insanity in our society?
Yeah.
Dre, can I ask you? This goes off on what Chris is talking about. I have a distinction in my mind when it comes to sexual orientation versus trans identity and that dysphoria, right? To me, I think there is something especially harmful about dysphoric conditions, right? Sexual orientation is about simply what your body reacts to, right, as far as arousal is concerned. And there's several discussions to have about that per se and all that. But when you're talking about dysphoria where the body is concerned, I could never imagine a scenario where encouraging it could ever be healthy. And not just with transgenderism, but think about eating disorders, right? Someone truthfully believes that they are fat, even though they are, I don't know, 5'2" and like 80 pounds, or 5'8", 90 pounds. Like they really believe that they are fat when they look in that mirror. We said earlier, someone who really, and I always forget, I know there's a name for it, a specific name for it, a dysphoric condition where you think you shouldn't have the arm that you have. You shouldn't have the leg that you have. I remember there was a Dr. Phil episode many years ago with a woman who blinded herself because she believed she shouldn't have been born with sight, that she shouldn't have sight. So I think there is something especially damaging about dysphoric conditions. And there was a time when I actually was, well, as long as they're adults and, they want to do what they want to do with their body, I'm someone who, as Chris knows, I seek logical consistency in my life. That's really what I try. Can I apply this across the board, right? And if I can't, I need to take some time to consider why I can't do it, right? Or can I justify not applying it across the board? And when I think of dysphoric conditions now, and I thought about that, I'm like, well, if I want to encourage someone who believes they're fat when they're not to lose more weight, right? If I want to encourage someone who thinks they shouldn't have their arm to cut that arm off, if I want to encourage someone who thinks they should be blind to blind themselves, to mutilate their body in that way, why would I then encourage someone who is severely confused about the sex, the body they were born in, to try to alter that? And so that is where I came to this point of logical consistency, and in regards to dysphoria. But then I'm sorry, I don't see any relation though to sexual orientation. To reiterate what Chris said, well, what's your take on that? Honestly, the distinction between sexual orientation and this gender identity, or any dysphoric condition, actually.
Well, I think dysphoria, I guess sexual orientation is more about like pleasure and feeling good or something, and dysphoria is about like kind of feeling bad and the opposite of whatever pleasure, which is dysphoria, I guess. So I think like the sexual orientation stuff is more of a gravitation to it because it's all about, it's kind of like pleasurable, it's romance, it's part of our human natural condition. Gender identity is something more, I believe, is more of a social construct, if you ask me. I think it's something that people actually can pick up because of what society tells them and whatever the case is. But I do feel like with the trans stuff, I know that we say a lot of, this is might be a little bit off the question, but like, I know when we say like, oh yeah, an adult can, if you're an adult, do whatever you want and whatever the case is. But, if you're using logical consistency, then can that be problematic in the long run when many adults start to transition, and then a society full of adults starts to encourage kids to transition, and whatever the case is? So like, that's just something of logical consistency, I guess, as you're saying. I mean, it's a little off topic what you were asking, but I don't know what your viewpoints on that is, because like I was thinking about that the other day, and I was just like, wait, like, we keep telling adults like it's okay to transition, it's okay to do that. Then eventually, wouldn't that be like a world full of transgender adults that are going to start transitioning kids, and more likely to happen? Like, I think there's like a logical consistency there or something. I know it sounds like bad, but I don't know. What do you guys think about that?
I actually agree with you in regards to this specifically, because the reason why is because you're going to have so many people, so many of those adults who are going to be like, well, if only I could have done this when I was a child, and therefore they're going to push for children to be able to do it.
Yeah.
And that is one of the arguments you get. Chris and I have faced this all the time, and I'm sure Dre, to a degree, you probably have as well, especially in your field, was we would say, right, that we would talk about all the advantages. Let's bring in sports, for example, right? That a man who's gone through puberty, right, and he transitions, right? Puberty changed his body in ways that will never be completely reversed, right? They just can't. You can pump him with estrogen all you want, but there are certain things that is always going to be his advantage, right? So then in response to that, though, they said, well, then that's why we should transition kids. Puberty blockers, right? So they won't go through those changes. They won't have those advantages. That is so, yeah.
You're damaging the child's negative loop feedback system in their brain.
Yeah.
Like the hypothalamus produces like the hormones, pituitary gland, all that stuff. If you do all that at that crucial year of development, that can impact their negative loop feedback, where it's like, oh, we're not having as much testosterone, brain send over more testosterone, and it's just going to discombobulate their whole system at that age,
Yeah. And so, Dre, I think you've proved that point. Sorry, Chris, I didn't mean to cut you off, but I think, Dre, basically to sum up what I'm saying, I do think that when we look at society, we have seen a trend that supporting, encouraging, just permitting transitioning with adults has come back to harm children. So yes,
no, for sure. I mean that's the whole thing that I was getting ready to say, Kevin. It's
yes.
like it's like, because that is the logical outcome. Obviously, they're gonna say, especially you gave a great example when it comes to the sports thing. It's like, obviously someone who's gone through male puberty, there's nothing that's going to be done to reverse it. So, oh, well, had we not allowed that person to go through puberty, then, the situation's fixed. Well, you know what I have to say to that, to everybody? It's like, too bad, so sad. We're not going to prop up your mental illness.
I mean, like I've seen it. I can't lie. Like, the truth is, I've seen how transgenderism has harmed families. I work with like, families who have like a dad or a mom that have transitioned, you know what I mean? And like, you just see like the impact of that on the family, and who ends up suffering at the end of the day is the child, so it's like, there's a lot of this stuff going on, and it does cause some distress, and then, it's not a healthy thing, I would have to say. I mean, like, just objectively speaking.
Sure.
Absolutely.
Hey, Kevin, let's get to these videos.
I was about to say, I was just about to get up there. I did have one more thing for Dre, but we're gonna skip over that, because I think, Dre, you kind of covered it earlier by saying that you personally are not interested in the conversion therapy as a general practice, because I was going to ask you for examples of
What happened? You cut off?
people coming in, but
Kevin
to those videos.
And he's still doing it. All right.
Yeah.
Kevin's frozen. So Chris is going to vamp right now. So why don't we, while we're figuring out the situation with Kevin, I'll take him off the stream.
Okay.
and Kevin, if you can hear me, just let me know when you come back on. Let's go ahead and play this first video. This will be kind of an interesting one.
Our daughter is 10 years old. She started letting us know that she was transgender really before she could even speak. She would do things like wear her sister's clothes, pretend that towels were her long hair. And when she was about 3 years old, she started to withdraw and become depressed. So we started doing some research. We talked to her.
I'm sorry. I'm sorry, guys. I've got to laugh at a depressed 3-year-old. I mean, I've got to fucking laugh at that shit. Right?
I don't even see 6-year-olds or less in my practice. I don't even see 6-year-olds or less because of that reason. Because what child is depressed at 5?
No, you do not have depressed children at 3. And, and I'm not a professional like you, Dre, but at the same time, I do have some common sense. And I just realized it's like, no, you don't have depressed 3-year-olds. You just don't. And, anyway, letting Kevin back in. There we go. Awesome. But yeah, you don't have depressed 3-year-olds. This is crazy. And, but then the other thing that's very interesting about it is what they're bringing up are all these gender stereotypes. Every single thing that these two crazy people that absolutely belong in prison for the rest of their lives because they are that incompetent as human beings need to understand that I, as a young person, also did those same things. I was at a huge rally under the rotunda of the Capitol of the state of Missouri, and I relayed to everybody how when I was a little boy and I was like 5 years old, I loved the movie version of the musical Oklahoma. It was very colorful, very filmed in the 1950s, but extremely colorful and wonderful and all that type of stuff, great music, that type of stuff. But I would sit there and I'd put on like blankets around me and I'd dance and all that type of stuff. And I did the same thing with like, putting the towel on my hair and everything. But guess what? I'm a man. I'm totally cool with being a man. And this is so stupid just because you saw your boy.
So and
like
actually,
it's
funny. It's funny what Chris was talking about that. I remember my sister when I was younger had this robe, right? I remember putting it on and twirling around because it went up in the air, like kind of like a twirling kind of dress. I remember wanting to play with dolls when I was little, and I'm terrified if I was a child today that some of the parents of today would be like, oh, well, that just means that you actually are supposed to be a girl. When I grew up to clearly be who I am right now, right? I'm very comfortable as a man. So, Dre, I wanted to ask you, though, because I know, obviously, in this video clip, I know I dropped out a little bit, but I've seen this video clip several times. They talk about, first of all, their child, knowing their child was trans before the child could talk, right? Before the baby could talk. To quote it specifically, that, what was it? Trans before she could talk, right? Now, Dre, could we get you to maybe psychoanalyze the parents a little bit here? Because this is what I was talking about earlier, right? We who's pushing the child, right?
I mean, I don't gotta psychoanalyze anything. You can just look at the shirts they're wearing, and that's all you need to know. Yeah,
Kevin, let me jump in here. I'm gonna give Dre a break. I'm gonna psychoanalyze them.
There you go.
They're crazy fucks.
I approve the psychoanalysis. That's all it is. I mean, you just look at them. That's like
we can actually go on to the next clip because the next clip is actually pretty much just like this, just
reversed. The first time that I realised Stormy wanted to identify as male was about We started being unhappy with wearing dresses, didn't like hair clips, didn't like the pigtails.
Stormy wanted to identify as male, but
Okay, didn't like hair clips, didn't like pigtails, didn't like dresses. So here we have the opposite, right? That once again, we see gender stereotypes being used, and we know that these people, both the parents in the last clip, especially that mother, and these individuals would probably get incredibly enraged if you were to tell a little girl, well, you should wear a dress because you're a girl. You should like pink because you're a girl, right? Because you're reinforcing gender stereotypes. And here's another example of using gender stereotypes to, well, my child's trans because my little girl doesn't like pigtails, hair clips, or dresses.
That's wild. That's what, I just don't understand. 2.5 years old, oh God, I don't know.
Well,
I mean,
I already knew what I wanted to do when I grew up when I was 2.5 years old. I'm just kidding.
I remember being younger, and one of my favorite cartoons when I was younger was The Land Before Time. I remember playing and pretending that I was a damn dinosaur. Specifically, I liked the Triceratops when I was younger. Clearly, I mean, oh my God, I just think about myself as a child and all the stuff I remember doing and the stuff I remember that I thought I could be. I actually have a very strong memory when I was little of watching like superhero movies, right? And people like flying, for example, right? And me and the other kids, when we were like 5, 6 years old, jumping up in the air or jumping off a lower step and trying to see how long we could stay in the air. Right? And I remember the adults around me saying, oh, that's a cute phase when they think they might be able to fly or float, right? Now, by that same logic, and like I said, I look for logical consistency, a truly who parent would be like, oh, well, maybe you should try jumping off the roof. You get more, air underneath you in that attempt to fly. I mean, it's absolute insanity. As children, we think we can be so many things. We want to be so many things, and there's magic in that. There's beauty in that imagination, right? We shouldn't destroy it, but we also shouldn't encourage insanity. Things that we know are just not possible. And in that last one, I actually want to focus in on something, because in that last one, the father, I believe, used the term male. Right?
Yeah, let's
now, this comes from a side that says there's a difference between gender and sex, right? That gender is between the ears, sex is between the legs. That's what they always say. Now, here, this is where they're conflating, and I firmly believe that the goal was to separate and then conflate. They had to take them apart so they could then bring them together. For example, why do you want your, here in New York State at least, our driver's licenses say sex on them, right? Not gender. But then if you're okay with distinguishing between sex and gender, then why do you need a driver's license that reflects your gender identity? It's just insane to me. And I actually think we need to call that out more, this conflation.
Mm-hmm.
Yeah, I'm just covering it up so people can't see, but the state of Missouri also does sex. I think it's interesting what you said, Kevin. What I was trying to jump in before you went on is like I almost wanted to play that again, but before you went on, because it was kind of good what you had to say, but I guess it's not necessary now. But yeah, it's I guess I don't want to beat a dead horse here because we might do that before. Let's play the next clip and then come out of that because, like I said, all of these are about this type of insanity. And
this one's a little bit different, though. It's comical, though, because out of the mouths of babes, as they say.
Yes, for sure.
White people that aren't like serial killers like Ted Bundy.
Does your mom say you have to be LGBT? No, I think she's what I want to be, but
Go ahead, Lex. Go ahead. Keep talking. Say what you're saying.
My mom doesn't matter if I am gay or lesbian or any of that. She doesn't care. All she cares about is that I'm a part of it. And if I'm not a part of it, she'll try to convince me to join it. Cause
What are you saying right now?
Facts.
That I would convince you to join what?
The LGBTQIA+.
Yeah. Like I said, out of the mouths of babes here. And this is, remember, Dre, what you said earlier? Children are blunt and say it as it is. And here we have this little boy saying exactly how it is.
You said it. That's crazy. I don't know. Like, it's a lot. Like, I think, you know, like when you're pushing that stuff onto your kids, I mean, like, I guess, is the mom coming? Do you think the mom is coming from like a good place with that though?
Okay. I want to believe that the majority of people, whether they, you know, they are supporting a trans child or encouraging this kind of stuff, like, you know, onto children, that they are coming from this place that they've been warped to believe that if they don't, they're bigots. So, and no one wants to see themselves as hateful, right? But I do believe there are people, most assuredly, who have a very dark agenda.
Yeah,
and with this woman specifically, I have to question.
I will say that I take a slightly different viewpoint. It still mostly agrees with you, Kevin, but a slightly different viewpoint. I do generally think that the vast majority of these parents are actually evil. They're terrible people. They're not intending necessarily to be that. But what I'm saying is that their sense of morality and sense of the world and the sense of reality, in fact, is so corrupted that they think that this is a good thing to do to their children. So, no, I honestly think, you know, I mean, if I had my way as dictator of the world, I would be like, yeah, this is a parent that needs their children taken away from them. They need to be locked up for the rest of their lives because they should probably never interact with humanity. You know? But I would never do that as a legislator, guys. I'm just saying that, you know, this is insane sorts of stuff. And no, I do not think it comes from a good place. You have to remember, Kevin, by the way, humans are self-serving, very self-serving. And, you know, the best of us, and it seems like we've got three very good people here. But the thing is every single one of us, all three of us, are extremely self-serving because, you know, that's just the way nature has made us. We have to survive. And what I'm getting at here is that, you know, these people may think that they're doing the right thing, but at the end of the day, they're doing it for some sort of self-serving reason.
Yeah.
And they're doing it in a because a really good parent is going to balance their self-serving nature with the needs of their kids. That's what a good parent's going to do. They'll find a way to balance that.
Yeah. So, Chris,
well, let me finish real quick.
Yeah.
But the thing is like these parents, the ones that we're looking at here, they haven't figured that out. They want to not balance anything. It's just my needs only. That's all I'm taking care of here. I'm not worrying about my child's needs. I'm worrying about my needs. And that is exactly what I see here.
Well, here's the thing, is Chris, the reason I take the approach I do, I acknowledge there is absolute evil in this world. I do. But I once heard someone say something, and I kind of added on to a little bit that really stuck with me when it comes to this kind of situation, is be careful to not attribute to malice what can be attributed to ignorance and or arrogance. Because, you know, the fact is good people can do incredibly evil things. I mean, most people who do evil, if you were to ask them and confront them, they wouldn't be, yes, I'm evil. They actually see the good in what they're doing. Just as, for example, someone who is evil can do some good things. There are evil people who probably nurture their children, right? could rock their children to bed, make sure their children get all the food they need and all that stuff, right? But they have very evil intentions in the world, right? But in one area of their life, they might have some good actions. So the thing is, I don't know. I've just engaged with so many parents that when I've had honest discussions with them about, pride. All right. So, and let me just, I think this will sum up what I'm trying to say here. Locally, I had a discussion about pride. Chris, you got to experience pride in my area. And
yes, I did.
These videos of a local pride where there was a burlesque performer stripping in front of children, right? Now, there was locally, there's a legislator that votes to, a county legislature that votes to endorse pride or to not endorse pride every year, right? And there was one guy who was a bit confused on it. And he said, well, I have family members who are gay, for example, and I don't want it to, be like I'm discriminating against them by saying I'm not going to endorse pride from my position, right? And I said, well, I've shown you what happens at Pride. Do you think that that is a reflection of your loved one? And they were like, no. And I'm like, do you think it's a reflection of your loved one? Nudity in front of children, lewdness, sexual performances in front of children. Is that a reflection of your loved one? They said no. So then by voting no to acknowledge Pride,
excuse me, I
Pride Month, you are not insulting your loved one. You're not. If you vote yes in the name of that loved one, then you are associating that loved one with those behaviors that take place at Pride. And so that's the thing. This person voted, in my opinion, voted yes towards a great evil, and I'm going to call it a great evil in our society, but they did so because they were really afraid of hurting someone in their life that they love. That they love deeply. And those are the kind of individuals that I'm referencing in what I said earlier. That I believe that many people are coming from a good place. They believe they are, which if they're coming from a place that they don't want to hurt someone they love, that is a good place. It's just good intentions. What is it? The path to hell is paved with good intentions. So that just to clarify what I meant by that.
Sure. Well, guys, I probably need to start kind of wrapping up.
Yeah, we
things
can
a
wrap
bit. I do have a visitor here in town.
Actually, but Dre, do you have any final thoughts on everything tonight?
No, just like the whole idea, I think like with the conversion thing, I just wanted to like ask both of you, like where do you both stand on it? Like, are you against the conversion therapy or are you against the free speech? Where do you guys stand on that?
Good question. I mean, as far as homosexuals, I'm obviously against conversion therapy because I don't think that it does anything. I mean, it might lead someone to lie about who they are for a while. And I do truly, honestly believe that the few so-called successes that we've seen are actually bisexual people. Well, they'll have sex with males or females, so it doesn't really matter, so what was actually converted there? What sort of success did you see? But when it comes to the stuff dealing with the transgender issue, well, I don't see that as conversion therapy. I see that as treating a mental illness. And it's very unfortunate that, the, DSM-5 has changed, definitions and that sort of thing, and that this is not seen as a mental illness. I mean, to me, it's like, okay, not to be too blunt, but I'm going to be, something's going a little bit wrong up here, because it's no different than, it's like, well, my gosh, I don't like that my eyes are here. They should be up here. It's kind of that sort of weird thing.
And well, I guess from my perspective, so I've thought about this, right? Because am I against conversion therapy. As I said earlier, I look at things broadly first and then I go in, right? The fact that I do see all therapy at the end of the day is about conversion from one state of mind to another. So I guess it's not so much for me about conversion therapy, is I believe that all therapy should be about getting to the root cause of whatever is causing trouble in a person's life. And if that will inevitably result in a conversion of their mindset, right? And if someone's gender identity is creating confusion in their life and harm, I don't think the goal should be to affirm them per se one way or another, but to rather find out what the source of that confusion is. Why is it they think? Is it because I've interacted with people who say, I just don't have, and I've talked to people who are trans, right? And they've told me that they just had nothing in common with their own sex. That doesn't mean you're not your sex, though. That just means you're not a typical male or a typical woman in your expression and in your interest, but you're still a man, you're still a woman, right? It's to find out where that source is. Because if they can accept, okay, I'm a male who has a lot of feminine interest, right? Or a lot of all this. Look at Jeffree Star, for example, right? Jeffree Star, the leave Britney alone tears going on, right? Recently came out and said, you know, talking about how he's a man. Despite the nails, despite the makeup, despite the hair, I'm a man. And I think that is about getting to the root of it. So, and I think if you get to the root of what's causing the conflict in someone's head, what's causing them mental harm, right? A conversion, a healthy conversion will take place one way or another. So, like I said, that's the thing. I can't just say I support conversion therapy, I don't support conversion therapy, because I believe that when you get to the root cause of a problem, there will be a conversion of the state of mind in a healthy direction.
Well, and like I was kind of saying, Kevin, ultimately the thing is like, I was just saying, it's like, I know what I like, and I don't think that it harms myself in any sort of way. But if I do look down there and I see one thing, it's like, it's kind of weird when people see something different, you know, and I guess that's sort of the thing that I'm kind of getting at there.
One more point I want to make, because I know we all got to go, but specifically, Chris and I have had the conversation about ex-gays, right? Now, the most common talking points that I hear from ex-gays, right? They complain about why they don't want to be a gay anymore, the hookup culture, right? The fact that they feel like men don't want to commit to monogamy. They feel like all these things. Now, what that tells me is they've come against struggles in their lives, right? They've come against personal struggles, and instead of associating, I think they're associating it with the wrong thing, the troubles in their lives. They're associating it with their sexual orientation and not their actions. For example, you're going to a club at 2 a.m. where men are dancing with their shirts off, and you're expecting to find monogamy and love. Why aren't you going to, I don't know, a gay bowling league, a gay basketball team, something? Why aren't you going to a different environment where you can make certain connections? But no, you're going to a club with young men who are dancing shirtless and all that stuff and expecting to find this meaningful connection. I don't know. Because also a lot of the complaints that I hear from ex-gays are complaints that I've heard from straight people in the dating world, but they're not trying to, they're not trying to be ex-heterosexuals, right? So I like I said, it's about getting to the root cause. If you get that man who wants to be an ex-gay to really address why he has an issue with his homosexuality, he's gonna discover that really what he has issue with is behaviors that he's taken part in that have led him to a miserable life. And he's gonna discover that those are actions that are not distinctly unique to his sexual orientation. But
I guess sexual orientation could be like hypersexuality too and stuff and things like that. Exactly.
Anyway,
let's end. I gotta go, so let's end it. Talking to both of you, this was a great discussion. I really appreciate the time. Thanks for everything.
It was great. All right, Kevin, do you want to give the final sign off?
Absolutely, everyone. Thank you for joining us this evening. Please like, share, comment. We'll catch you next Monday at 8:30 p.m. Central Time, 9:30 p.m. Eastern Time. As always, have a good night. God bless.
Take care, guys.
Take care, everybody. Have a good night.
All right, everyone, and we are live.